We are so excited that you are joining us to Year-End Prep with Jane. Before I pass the mic to Dr. Julie, I wanted to give everyone in today's session a little context as to why we wanted to invite the Ginger Desk team back to present on this topic. So, as you may or may not know, the Ginger Desk team are virtual assistants for your healthcare practice, and they have so much real-world experience helping Jane clinics just like you. And so today's session is also a great companion to one that we hosted a few weeks ago, Year End Tips and Tricks with Jane, featuring Sayada from the Jane team. So we can pop a link to that in the chat as well, and we'll include it in the follow-up email. So between that session and this one today, we hope you feel prepped to wrap up the year and ring in 2025 organized, relaxed, and ready for the year ahead. So if you are looking for any Jane specific training, you know that we've got our YouTube channel and our guide. So we've got you covered on that. And you can always reach out to the Jane team at any time you want. And one last little plug I wanted to share is you may have seen this in an email or on social media, but we recently launched a podcast, Radio Front Desk. And so this is a companion to our Front Desk magazine, which you may have received a copy of or seen if you've connected with us at a trade show or an event recently. And fun fact, Dr. Julie was one of the first guests on the podcast, and her episode will be going live tomorrow. So you can find it on Spotify or YouTube. We'll share the link in the comments and follow-up email as well. And there are lots of great episodes coming out for season 1 of the podcast, and we'd love for you to give them a listen and let us know what you think. And my final piece of housekeeping is that we will be wrapping up the session and we'll share a quick poll. When we're wrapping up the session, we'll be sharing a quick poll to gather some feedback. So if you are so inclined, please fill it out as it helps us improve and plan for future sessions. And that is it. That is my 5-minute housekeeping. So with that, the mic is yours, Dr. Julie, and I can pop back on the end if we have time for Q&A. And as I said, if we don't have time to get through all the questions, we will do our best to answer those via email. So with that, Dr. Julie, take it away.
Thanks, Dustin. That's so great. What a great intro. Thanks for doing all the housekeeping. Hi, everyone. It's so great to be here speaking with Jane again. Thank you all for those of you who are joining us live. Thanks for being here and taking this time out of your day. For those of you watching this recording, thanks for being here and for taking the time to watch this. I know how busy we are as practitioners, and I'm so grateful that you're here. So welcome to Ginger Desk's Guide to Year-End Prep with Jane. I'm going to be talking through all things what you should be considering before December 31st hits and what you can plan for in Q1. If you have questions, I'm going to see if we have time at the end, and then we'll be jumping into Q&A. So as Dustin said at the bottom of your screen, you can hit the Q&A button, pose your questions there, and if we can't get to them at the end of the day today, what we'll do is we'll send over some email responses later. So let's dive in. So a little bit about me. For those of you who haven't yet met me, haven't been in our community here at Ginger Desk, I'm located in Vancouver, Canada, and I've been a naturopathic physician for 18 years now, since 2006. Before launching Ginger Desk, I was deep into practice, and I had a special practice focus in women's health and pediatrics. So I worked for years and years with all kinds of families. I did lots of prenatal work, fertility and PMS, and then I treated all things pediatrics, which was such a joy. I'm a 2-times clinic owner, so I currently run one of my clinics still. It's called Restoration Health Clinic, and it's right here in North Vancouver. And fun fact, it's actually located right across the plaza from Canopy Health, which is where Allison Taylor launched and birthed Ginger Desk, or Jane. So it's really cool that I actually started Ginger Desk in the same location, right, literally across the street from where Jane was born. And it's really cool that we've got these 2 companies coming out of Lynn Valley, this small, sleepy little town in North Vancouver. I'm also a parent to 2 boys who love to tempt gravity and skateboard. And then I'm the founder and CEO now of Ginger Desk, and we're a team of virtual assistants who are specially trained to support health practitioners just like you and me. So let's jump in today. A little bit about Ginger Desk is, I'm just going to adjust my screen here and then I'll be right with you. is we're a team of virtual assistants who provide admin support for solo practitioners and clinic owners. And we run the front desks of your clinic so that you don't have to, and you don't have to worry about admin turnover, training, and management. We are also expert users of Jane. So our entire team is trained to be expert users of Jane app. We perform setup and optimizations of Jane accounts. So we don't just do the day-to-day of your front desk. We can actually do one-time projects to make sure that you're getting the most that you can out of Jane software. Our team is all based here in Canada. In fact, our team is mostly made up of women. A lot of us are parents who are just so happy and proud to be working from home, supporting practitioners like you. And our head office, of course, is located in North Vancouver, just like my clinic. So today, I'm going to be talking about 3 topics. One is cash flow. The second is data. So we'll jump into what reports and trackers you need to really consider to end your year on a high note. And then we'll be talking about communication. So when I talk about cash flow, I mean accounts receivable, because look, what I know about business is that cash is queen. And if you're not managing your cash flow properly, it could really impact the health of your business. I then surveyed our Jane ambassadors and actually asked them what the best reports were that they found to be most useful in Jane. And so I'm going to be talking about what those critical reports are that you need to really know and delegate to your team. And then I'll be talking about how critical communication is to not just your team, but also to your patients and your practitioners. So we will jump right in here. So the winning formula that you need to remember throughout this webinar is that you are the leader. So I talk to clinicians all the time, all day, every day. And what I know is that leadership is a tricky place for us because we see ourselves as practitioners. But when you're running a business, when you're running a practice, when you're running a clinic, you need to also see that you're not just in the business working as a practitioner. You are the leader. And as a leader, you need to be focused on some different things than you need to be focused on when you're working in the business. So when I speak today about what you, the leader, needs to do, you need to be thinking high level. Like, here are the things that you at a high level as the visionary for your practice need to always have top of mind and have your finger on the pulse for, versus what can you delegate. So when I talk about delegating, I might be talking about what you can ask your marketing team to do, your admin front desk team, or your accounting team. But you, the leader, are going to be doing different actions and activities than you, the delegator. And so that is the key formula for practice success in 2025. So we're going to talk cash flow, data, communications. Those are the top 3 things you need to know for ultimate practice success. All right, let's talk cash flow. So here you are, you and Jake Gyllenhaal, leaving for vacation this holiday season, knowing that your accounts receivable is totally up to date. Look how happy and relaxed and grateful he is. And I want to remind you that even with a steady revenue in your practice might suffer due to poor accounts receivable management. And I don't mean to be Debbie Downer here, but this is the reality of us in business, is that when we talk about clinics and businesses that are successful beyond year 3, 5, and 10, we often hear, well, if you can make it to year 5, you've got like an 80% chance that your business is going to survive. The reason why businesses don't survive, the number one reason why businesses don't survive, is cash flow. And it just is. It's the number one reason why businesses fail. And for those of us in healthcare, in private practice, with small businesses, we are especially vulnerable to this. And for anyone who's also collecting insurance, you know that that is another pain point and adds another variable to how difficult it is to collect accounts receivable from your patients. But I want to remind you today that A, you're vulnerable, and B, cash flow is the most important thing that you can focus on in terms of your practice's success, because your team relies on it. your patients rely on it, and the health of your business in the long term relies on it. And we're going to talk about how cash is queen. Notice I didn't say cash is king. Cash is queen here. I think we always need to remember the power that cash has in not only us getting paid, but actually us sustainably running a business that can support hundreds or thousands of patients down the road. So you as a leader need to commit to the discipline required in implementing systems to collect those accounts receivable. But then further, you need to be super disciplined to make sure that the accounts receivable is being collected. So it's one thing to set up the systems. I know this at Ginger Desk, we set systems up day in, day out. It is tricky, it's challenging, it requires a bit of a visionary approach. But then the implementation day to day is what gets challenging for us, because you've got to make sure your team is on it. You've got to hound them. You've got to make sure that SOP is super clear and that there are timelines associated with it. So the discipline is on you as the leader to make sure that the systems are being followed. And then I also want to remind you of my mantra. And it took me years to come to this and to really feel settled with this idea. But it's this, it's that payment is due when service is rendered. And look, we are all in the healthcare industry because we love to be of service. We love what we do. We're so passionate about healing, our discipline, and serving people. And we are all compassionate, and we also tend to be empaths. And the trouble is, when you take that part of our personality and ask us to also collect payment when somebody doesn't want to pay, it can be a recipe for disaster. So I invite you to, if you're new in practice, if you have problems collecting, I just invite you to consider this mantra. Payment is due when service is rendered. It's an energy exchange, is what it is. You know, you perform a certain visit or consult or treatment for your patient, and then the energy exchange is that they then pay you for the performance you just performed. And so if they don't do that, the energy exchange is off, and there's no apologies needed. There's no begging. There's no fluff required. It's actually, oh, you didn't pay. And here's what I expect moving forward. And so I'm going to talk to you about a script that I find to be really helpful in a moment, and that's something you can delegate. But first, you as the leader need to consider this, where your limitations might be in your money mindset around being able to receive money for a service that you have just performed. And then I want to show you that collections can be done with compassion and clear boundaries. And I want you to align with that, because that will ultimately be what makes or breaks your cash flow, and your cash flow systems will be your mindset around money. So let's jump in to my 11 best accounts receivable practices for you as a leader. So this is not what you're going to delegate. This is for you to actually own. So you might take a screenshot of this. There are 11 of them. There's 6 on this screen, 5 on the next, or you might wait for the recording to be sent to you, which is totally fair too. But here's what you need to do, 11 of them. Number 1, your AR, your goal needs to be to get your accounts receivable collected within 48 hours. So the best way to do this is, I like to say this, automate to accelerate. So you might use Jane Payments to make things quick and easy. So one best practice here to get AR down to below 48 hours is to have a credit card on hand. Or on file. It's really simple, but collecting a credit card on file means that you're in control and you can click to charge them. You can always send them the invoice and wait for them to pay. It just then might be that it's beyond 48 hours. If you want to keep it under 48 hours, consider automating to accelerating payment. And number 2, nothing should ever go beyond 30 days. Nothing. If it goes beyond 30 days, what we find at Ginger Desk is chances are there's very little chance that you're going to collect it. So your best chances are that first 48 hours, then the next best chance is 7 days, and then before 30 days. So aim for that and really keep an eye on that. And I'll show you what you can delegate to make sure you're keeping an eye on that. And number three, consider implementing a late payment penalty and then talking about it. So I have implemented this many years ago at the advice of actually my lawyer. It is very, it's very typical here in Canada anyway, for us to charge 2.5% on any balance that's beyond 30 days. And you may not even have to charge it, but just actually communicating at the bottom of your invoice that there's a late payment penalty of 2.5% for any balance beyond 30 days works wonders. So consider just typing that out today if you can get to it. Number four, have the dialogue really early about expectations around payments and accounts receivables, because accounts receivable, once it's past due, once the payment hasn't been received when service was rendered, it's so much work. And it's so much easier to pull a lever and prevent late payments when you've got the chance. So have that dialogue early. So include it on your intake form, include it in your consent form, and include it in booking descriptions. You can actually say, we will be collecting from your credit card on file after this booking. Why not just say it, right? Like, communication is kind, being clear is kind. And you really can't say this enough to patients so that they can't turn around and go, oh, well, I didn't know. I kind of thought that I could just pay in the next month. No, not appropriate. And then get a policy in place. So the best way for your team to protect you and to truly be your gatekeeper is when they can refer to a policy for the practice, not just that you said so. So what I mean by this is that it's so much easier for me to say, there's actually a policy in place for the clinic that requires you to pay at the time of service. That is so much easier to say to a patient than, actually, I prefer to collect payment the same day, or than my team to say, Dr. Durnan likes to collect payment same day. Oh, that's too bad you can't pay. Instead, what they can say is, the clinic policy is we collect same day. And then they can stop talking. That's the boundary and that's the policy. And then now it's not emotional. It's just a matter of fact. That's actually just the clinic policy. And it's so much easier when we can remove emotion from collections, because they can get emotional and we all tend to get our money mindset wrapped up in it. And then number six, when to consider a payment plan. So I invite you to consider what you would do if a patient went beyond 7 days. If they went beyond 30 days in payments, would you offer them a payment plan? It's good for you to think about this in advance so that you just know. And so your staff knows that they can offer this as a solution. It might not be something you want to offer. I've offered it to one patient once where they legitimately had something impact their financial situation right after our visit. And they requested it and we said, sure, like, let's just pay in 3 chunks over the next 3 months. We made it work for them. It might depend for you. Like, if they're a patient who's devoted and really respects your practice over the last 10 years, maybe you say yes to that, versus maybe someone who's newer to your practice, that's not an option. But it's good for you to consider, is there a possibility, if needed, to put a payment plan in place? Think about it ahead of time so you can map out the steps, and then it's no problem if it happens. And number 7, consider your SOP. So SOP stands for Standard Operating Procedures. You might call it your office manual, your practice playbook, whatever you want to call it. This SOP needs to have a section on accounts receivable. So standard operating procedures for your accounts receivable, and you need to be in charge of making sure that your staff knows every step of the process. So if it's not documented correctly, you're in charge of making sure that that gets corrected. You're in charge of being the visionary over reinventing what your patients might better enjoy. So I just want to point this out, because as leaders, even though we might delegate a task, something like an office manual, ultimately the vision comes from us, and it has to come from us, because we're the ones that are laying out the client journey and we're envisioning how we grow and scale. And so we want to make sure that the processes best reflect how we're growing the business. And so that does land on you. They can then execute how it's carried out from there. And then number 8, you want to consider when to dismiss a patient because you might need to do that. If somebody doesn't pay their bill once, you might want to consider that they're gone from the practice. I've seen some clinicians actually see them again a second time and be okay with that, trusting that they'll pay the next time. So at Ginger Desk, it's kind of 50-50. We see some clinicians dismissing them right away. We actually have others that give them another chance, even when the bill's unpaid. It's up to you. It's totally your call, but have a plan for this and then outline that in the SOP, what you'll do in the case of non-payment and when dismissal is okay. And then you'll need to figure out how to actually dismiss that patient. So I have dismissed 2 patients in my lifetime, my 18 years as a practitioner. It's never fun, but it's always needed when you actually make the call to do it. It feels so much better when it's done. So there might be a time and a place for it. And then also consider when to escalate and how you're going to escalate. So back a few years ago, many years ago, actually, I had a patient who just would not pay their bill. And it was such a big bill at the time. It felt like a big bill for us. And my dad, who is so wonderfully assertive and kind and has a much deeper voice than I do, is also, or was, is he's a retired accountant. He actually phoned the patient on my behalf and acted as my collections agency. So he called as my accountant and insisted that they pay the bill. And he was my accountant, so it was legitimate. You might consider having your accountant call if the patient isn't listening to you and your staff. You might consider your accountant calling the patient. You might consider having an assertive friend step in and see if they could collect. You don't necessarily have to go to a collections agency. So that's something that we've had practitioners ask us at Ginger Desk, like, when do I escalate to a collections agency? The truth is they're so expensive. And unless you're a really big business, like probably grossing 20 million a year, I wouldn't really suggest that you go there because they're going to take the bulk of that collections for themselves. So I think you can do this on your own before resorting to that. That's my opinion. And then you might want to consider cash management tools. So if you know that you've got insurance collections that are going to have some gaps next year, there is no shame in planning ahead for this to get ahead of the curve and get a line of credit. So LOC here means line of credit. Acronyms can be confusing. And so I just wanted to spell that out. So maybe you consider getting a line of credit that you will use and pay back month after month, just to utilize to manage those gaps in insurance, or maybe to manage the gaps because you've got a tricky population of patients that don't pay within 48 hours. Whatever your reason is, it's something to really consider ahead of time. And then know your aging reports. So these are things you can have your patient or not your patients, you can have your team pull for you so that you are totally in the know of what patients haven't paid within 30 days, which patients have gone beyond 30 days. You really need to have your finger on the pulse of who has not paid their bill over 30 days. There might be grounds for dismissal. You might want to escalate it to your accountant. You might want to do something about it. And then 60 to 90 days, that might be something you write off and you need to just simply clean up. Now, what should you delegate? So these next steps are for you to delegate to your team. This is what they should be doing for you. So my rule with accounts receivable and team members is follow up fast. You don't let accounts receivable sit, because what we know is that the longer it sits, the less likely we are to collect. So anything after 48 hours is a little bit too slow. Try to collect it, card on file within 48 hours. After that, we are on it. We are following up with an email, a phone call, and an email. So that is my suggested cadence. It's number 2. It's alternate and repeat reminders. We have found this at Ginger Desk to be the most effective way to pattern interrupt people, patients who need to pay their bills. So you might feel that it's annoying, but the truth is there is so much bombardment in people's email inboxes these days that they might just simply have missed the invoice. They might have missed your email. So you need to actually remind them frequently and in different methods of communication. So daily email after 48 hours, send an email. 24 hours later, send a phone call. 24 hours later, send an email. You might consider a text message. And now at this point, we might be beyond a week. We might be at 10 days where you're still waiting. So here is a helpful script that we have employed, and you can customize it depending on the timeline for when the patient's paid and depending on your comfort level with what you're going to request. But the 3 rules you need to know in the scripts you're sending are this: be clear, be concise, and be direct. So don't be fluffy and don't send too much flowery communication. And I am totally always guilty of sending really, really flowery messages. But when it comes to accounts receivable, you can't be flowery because you don't want to distract people. You want to get right to the point because their time is important and you want them focused on the request. So here's my suggestion is, dear patient, your payment is now past due. So look, right to the point. Your payment is now past due. Based on our records, your invoice for $240 is now 10 days overdue. Please note that at Restoration Health Clinic, payment is due when service is rendered. We have contacted you 5 times about the above payment or the attached payment during the past 2 weeks. So be really clear on the attempts you've made in case they've lost your emails or didn't get your voicemails. And then you have some options for questions you want to ask them. So if they haven't paid and it's only been 2 days, you might actually just come right out and say, look, do you need an alternative plan for payment? Maybe they just need 3 days. Maybe their mortgage rate just went up and they just fully went into overdraft and they're like, oh no, I am totally going to pay you. I'm so sorry. I just need 2 days to pay this. You just want to give them the option so that you just really want some communication from them. So in my experience, the best bet is to ask a question that requires them to answer. You're more likely to get a response from them. So flat out ask them, do you need an alternative plan to pay this? You might also say, like, can you provide another card for payment? Here in Canada, you might say, would you like to pay by e-transfer if that's something you offer? Maybe it's Venmo in the US. There might be an alternative form of payment you want to offer. There might not be, but plan for that and then include that in your options for scripts for your staff. And then flat out ask them, do you require additional time to pay this? So you might not include all of those questions. You might just include one, but have a think about what's the appropriate question for this particular patient that you have in mind. Now, reconciliation. You need to tell your team to reconcile your payments daily. Daily. I've said this before on multiple webinars, but here at Ginger Desk, we have seen some real horror stories where the front desk team was never requested to do reconciliation. And then what happened was they had like a year's worth. This is one case I'm thinking of. They had literally a year's worth of payments that were done incorrectly and not collected properly. And then the practitioners didn't get paid. This was a huge multidisciplinary clinic I remember we supported. And then the practitioners didn't get paid. They were behind in hundreds of thousands of dollars. So the simple SOP direction of reconcile accounts daily clears all of that up. It means that your admin team is now responsible for making sure that they put that in their day. They can make sure they reconcile any taps you've got in clinic. Maybe you're using QuickBooks on the side. Maybe you've got e-transfers. I mean, things can be messy in practices. We know this. And then add to that insurance. There's a whole bunch of asynchronous collections that you might need to put together. But delegate that to your team, and they need to do it daily. And then think of your admin team as your gatekeepers. I think that this is such a great catch-all, and I really like this title or kind of like name for VAs or for admin team members. I love to think of them as your gatekeepers because it gives me all the warm fuzzies, because it's like they're not just here to support patients, they're here to protect you. and your practice and your clinic, and they're here to uphold the boundaries and the policies in your office manual, and they're here to work out those systems. So use them as such. So make sure that they're clearly understanding your policies, and then they can uphold the boundaries for the practice and everything goes more smoothly. Patients are happier, you're happier, everybody gets paid. It's so wonderful. And then make sure you're cleaning up old accounts receivable regularly. So it's not enough just to reconcile daily, but make sure you're pulling those reports, those aging reports. And if stuff is beyond 90 days and you know you're just not going to collect it, like really go in there and address it. You don't need to have that stuff sitting around constantly distracting you. If it's something that you're not going to collect, go ahead, clean that right out of there. And then make sure that your team has an SOP. So they have a standard operating procedures manual that has a section on accounts receivable. I think I've said that 3 times here, but it's just so critical. If they don't know what to do if somebody doesn't pay, chances are you're not going to collect it. So it's really simple to just make sure you've got those steps outlined, the what ifs. And then ask your team to pull reports for you on a schedule. So there might be certain reports that you want to see weekly versus monthly. You might want to see some daily, but chances are, if you're anything like me, you probably don't have the time to look at them daily. So I suggest blocking time in your schedule once a week or once a month, and then tasking your admin staff to send you those reports before that time is blocked in your schedule so you can sit down on the regular and be super efficient going through those reports. Awesome. Okay, data. Let's move on to data. You need to measure what matters. So for you as a leader, here's your leadership rule with data. You need to be in charge of knowing 3 things all the time. What's the money coming in? What are your retention numbers? And what are your top performers? So top performers might be your practitioners, it might be your patients, it might be your products or your treatments. So there's a number of different ways that you can look at your top performers. And the coolest thing is that Jane has reports for all of them. So now people ask me all the time, which reports should I be pulling as a clinic owner? And my answer is none. You shouldn't be pulling any reports. This is the job of your admin staff. Your admin team should be sending these reports to you as part of their standard operating procedures on a certain day of the week or a certain time of the month so that you can sit down at a designated time and quickly analyze them. So I think I've hammered that home. Let's jump into your team. Here's what you need to delegate to your team. So again, you can screenshot these tips or you can wait for our recording. But the number one thing that we see clinics not utilizing are trackers. I love a good patient tracker, and this might be that you're using a CRM, it might be that you're using Excel or Google Sheets, but a tracker is a way that you can track new patients that have come into your clinic and how they're faring throughout the process. You might have a tracker for patient reactivations or patient recalls, we also call them. If you're not tracking it, it's probably not happening. So whether you've got a software or a sheet for this, it's so helpful. We have a lot of naturopathic physicians and functional medical doctors that we work with at Ginger Desk. For those of you using labs, and chiropractors, nutritionists, I know you're all using labs as well. If you're prescribing labs to your patients, you really want to employ a lab workflow and track them, because you need to know when the rec was sent out, when the results are expected back, so we can get the patients booked in to review. So delegate all of these to your team and make sure that they're sending you updates on how the trackers are doing regularly. Number 2, here's the number 1 report that I send to my bookkeeper and my accountant from my clinic. You go to, I'm trying to make this as simple as possible, but we've got the Jane's customer support team is here in the chat. So if you have any questions about where to find these reports, we'll let the Jane team help us out here. If you go to billing and then sales by staff member, you can send that list to your bookkeeper and accountant. That is literally all I send to my bookkeeper. And now I might be a tiny bit more hands off than some other owners who are doing payroll on their own. But for me in my clinic, I have a bookkeeper do all my payments. This is the one form I send them. And then we have all of our accounting in QuickBooks. This is a super simple one that outlines exactly what each of my doctors sold, whether it's treatments, supplements, labs, IVs, whatever they did. That's the one thing. Now, like I said at the beginning, I asked our Jane ambassadors which reports they found to be the most successful. And I heard from loads of ambassadors. This was so helpful. So I've made this list really succinct with the top reports suggested by our Jane ambassadors. So the top reports that you as a practice owner or clinic owner should be sending to your practitioners. Now, if you're a practitioner in your clinic, you should also be looking at these for yourself. Number one is that same one you're sending to your bookkeeper. So you want to see the total sales by staff member. Number two, go to reports and then patient retention. And let's look to see the percentage of patients that are returning within a certain time frame. So you really want to see this above 80%, in my opinion. Anything below that, you might want to have a conversation, a goal setting meeting about why you think patients aren't staying, why patients aren't coming back. And then the next step to that is actually the next report. Go to reports, unscheduled patients. So you can then see in that report who hasn't been coming back. And I always find this fascinating because data tells you one thing, but there's always a story behind the data. And so for my practice, when I was treating a lot of children, often I would have a ton of kids on my unscheduled patient list. And if my retention was low or lower than usual, I would look and it was that a lot of the kids weren't coming back, but it's because the moms were coming in. So I just had to know the story of how my practice worked. I had the moms coming in and they were still asking me questions about the child. I was pulling up the child's chart. I didn't actually have the child on my schedule. So it's good to have that conversation with your practitioners. If you're an owner, chat with them, give them the benefit of the doubt. Like, why are these people not coming back? Did they move? Did you refer them to an oncology naturopathic doctor because that wasn't in your wheelhouse? Maybe you're a physio and you sent them over to see an exercise physiologist. Whatever the reason, go through that list and highlight with people that you think legitimately should have stayed. And then those are the people we want to do recalls on. And then ask your team to send you these reports monthly. So there's a bit of a list here, but you want to see the same thing, sales by staff member, to see how sales are going. You need to know the money in. Then you want to see average visits per client. This is really important because you actually want to know when you're losing folks. So are you losing folks at the third visit? Are you losing folks at visit 7? Why are they dropping off? And then you could actually go in and get practitioners to do this exercise. Go in and kind of go through what you're saying at each visit. At that visit where they drop off, what are you going? Are you not giving them a future plan? Are you lost and you don't know what treatments to employ after that point? There's a real audit that you can do of your visit to figure out why they're leaving you at that point. Also, let's look at average sale per visit because you want to see that going up over time. Cost of living goes up over time. So your average sale per visit should be going up over time. Maybe you also want to put more focus on marketing certain treatment types over others. There's so much analysis you could do on that report. And then, of course, patient retention. I mean, ultimately, it's so much easier to keep a patient happy than it is to go and find new patients. So that patient retention report is critical for you to understand to see the health of your practice. And now communications, here we go. So there are 3 tips I have for you for the end of the year for your communication strategy. 3 tips. Number 1, vacation. So chances are your practice will be closed for 2 to 14 days over the holidays. I can't say this enough. Signs, signs, signs. It sounds like you might be annoying to people with all the signs, but you cannot communicate your closures enough. So there are 7 areas where you need to consider communicating closures. Number one, your front door. This sounds so old school, but if you have a physical brick and mortar practice, put a sign on the door. Say that you're closed. It is super easy. It takes 2 minutes to print it and just pop it on the front door. You might even have one that you make really beautiful, print it at a print shop, and then reuse it. And maybe you just have like a certain date that you end up putting a sticker over. Whatever you do, you need a sign on your front door if you have a brick and mortar. You also need to have a sign at your front desk. So this is for folks before your closure, so that when they go to your front desk to pay, to talk to your front desk, they can clearly see it as they're checking out. You can't communicate enough with these people. So get that sign at your front desk, tell them you're closing, make it really obvious. Change your voicemail before the closure. Make sure that you are very clear on the voicemail that you are closed and what day you reopen. Make sure you edit your email autoresponder. You might consider sending out a text. So a lot of practitioners I know these days are using text messaging for mass communications. You might consider that. Definitely a newsletter. If you've got a newsletter going out, mention your closures in the newsletter. And then this is probably the most important part, your Google business update. If your business is on Google, this is the biggest thing I see newbies missing. You need to update it with your current hours. So log into your Google My Business and go in there and update it for vacation closures. And the thing is, you can go in and actually plan for your entire year. You can book off all the stat holidays, any weekends, any staff parties, whatever you know, whenever your clinic is going to be closed, just plan it a year ahead and then it's one and done. And then number two, plan for your New Year patient newsletter to get your patients excited about Q1. So we are only on December 10th today. You have so much time still to plan out Q1. When it is Q1, so when I say Q1, I mean quarter one to the end of March 31st, January 1 to March 31st. It's too late to plan your newsletter in January. Plan for it now. Just map out what things you want to be excited about in Q1, what programs you want to really highlight to your patients, and then just plan it, get it schedule sent. Boom, it's going out at the beginning of the new year. Your Q1 is done. And then number three, don't forget to communicate lots of words of gratitude to your team. So this might be your practitioners that you work with if you're a clinic owner. It might be your admin staff. It might be your marketing team, your accounting team, those people that work really closely to you, your team. Words of gratitude go such a long way. So it doesn't have to be that you need to plan a really elaborate party or really elaborate gifts, but I cannot tell you how day changing it is or job changing it is for an admin staff member to hear thank you for an excellent job done from the practitioner they support. So I know this firsthand from here at Ginger Desk. Every time our virtual assistants get a shout out or a thank you or a kind note or gesture from one of the practitioners they support, they often share it on our team chat, and it's just so beautiful to see everybody celebrating that virtual assistant. And it's so interesting, right? It didn't take any money or elaborate spending. It was just straight from the heart. And it really, really goes a long way. So, you might even just think today, before the end of your day, thank your admin team for everything they did. And especially if it's been an especially busy time with patients or a tough time for them where there's maybe been some challenging patients, really take the time to send them a card, write them a really kind email at the end of the year. You might send them a digital gift card, maybe a gift. At my clinic, we're having an end of year party tomorrow. We're having a taco night. It doesn't have to be super fancy, but just an intentional time to celebrate them is just, it will change the way they perceive their job. Okay, we have a couple more minutes. I know we're almost to the end here. I want to give you my bonus end of year to-do list. So 7 tips to get your year off to the best possible start next year. Number 1, schedule all your vacations ahead of time. Go into your Jane account and book the time you know you're going to be away with your family. Goodness, we see this all the time. We get patients booked during spots that shouldn't have been opened. So tell your admin team all your vacations today and get them to go block those out in 2025. Plan out your new year programs so you can send one newsletter in January, getting them super excited about what's to come. You might not even have the details of those programs outlined, but you could send a teaser about the high level topics that you're going to be presenting in the new year. Plan out your Q1 marketing plan. So this might be email campaigns, maybe it's paid ads, maybe it's collaborations with other clinic owners, webinars you might be doing, whatever your marketing plan might be. Solidify that before year end now so that you can hit 2025 with a bang. Plan out your Q1 comms as well. So when I say comms, I mean communications, but plan out when you're going to be sending newsletters, when you're going to be communicating with your team. Really think about messaging that you want to get out there. Maybe you're redoing your messaging to your team or to your patients. Think about what you want your communications to look like and get it solidly planned out before December 31st for at least January 1st to March 31st. If you can do the whole year, wonderful. And then consider an end of year party for your team or the words of wisdom, like I was saying, the words of gratitude. If you can't handle or manage to plan an end of year party because it's super busy for you, maybe you want to consider a new year team party. And this doesn't have to be in person as a meal. This could actually also be a virtual game that you just get together, play a fun game together. Maybe you do a virtual escape room or something. There could be a gathering. But I've personally done this at my clinic twice where we've had a New Year's party instead of an end of year party. And it goes over really well because the team is really happy and grateful that you haven't eaten up their December time with a work event. So you might consider a New Year's party. And then remember the signs. I said signs. Get those signs up for the year and make sure to spark joy when you're putting the signs up. When you're putting an autoresponder on or putting a sign up at the front desk, consider how you might just thank your patients for trusting you with their health journey. Consider maybe a beautiful photo you want to include or a cute graphic, something that might spark joy for your patients to remind them why they work with you. It's an opportunity, right, for this sign to not just be informative, but to also just be a really kind and kind of fun communication. And then number 7, this is my favorite tip of all, is take inventory of what worked. So I invite you to consider for 2024 what you should stop doing, what you should start doing, and what you should keep doing. And then I invite you to just sit and journal that yourself, but also survey your team and your patients and ask them the same questions. And it is amazing the information you can get from them. So how can Ginger Desk help? We are so excited to be official partners with Jane so we can help more health practitioners than ever reach admin freedom. We can set up new Jane accounts. We can optimize your Jane account, but we can also handle your front desk. We do 99% of what the front desk does outside of greeting patients physically and cleaning the room between consults. We can do all their booking and scheduling. We can handle communication by email, text, and phone. We also do live phone answering now. We can do billing and payables, and we can create practice playbooks. So if you don't have an SOP, a standard operating procedure manual for collecting AR, accounts receivable, you can have us build that out for you. Take-home messages. Your admin department needs an intentional end-of-year review. You as the leader are in charge of that. You as the leader are also, you need to be incredibly disciplined with accounts receivable because your cash is queen. You need to measure what matters and then delegate reports to your team for your own review monthly. And you need to make sure to communicate intentionally with your patients, your practitioners, and your admin team. And then a reminder that Ginger Desk is here to help upgrade your admin department when you're ready. So thank you, everyone. Before we jump to Q&A, I don't know if we have time for Q&A. Before we jump there, I want to let everyone know about a special offer we have for those of you who are both attending this webinar live and watching the recording. For anyone who has registered for the webinar, if your name is on our list, we are offering you 20% off your first month with Ginger Desk. So there's the QR code to book your discovery call. And you can also head over to gingerdesk.com for more information and to book your call there. Thank you so much to Destin and the Jane team for having us. And thanks so much for taking the time to be here with us today. This was so wonderful, and I'm so grateful for all of you. I wish you an incredible December, and may 2025 be your best year in practice yet. Thank you so much.
That was so great, Dr. Julie. Thank you so much for taking the time. I think we had a couple questions that maybe you might be able to answer quickly as we sort of wrap up and have the poll that's coming up. And so there was one from the beginning. You had mentioned the 2.5 interest rate, and someone was just asking on outstanding balances, is that standard for Canada and the US? Is that something you've just sort of come up with on your own? Like, how did you come to that figure?
Yes, I actually wanted to make that 10%, and it was our legal advice and the accounting advice I received was that what would stand up in a court of law was a max of 2.5%. So that was Canadian advice here in British Columbia. You might want to check with your own area and your own advisors, but apparently that is pretty standard practice.
Mhm. Awesome, thank you. And then there was another question. How does your team calculate average visits per client, average sale per visit?
Oh, this is by looking at through Jane. So we look at different Jane reports.
Awesome.
Yeah.
And then do you have a template of tracking clients' attendances? She said, I'm curious how to track clients in a systematic way, as I've never done that, but wonder who didn't come in for a while.
So I would pull the unscheduled patients report to see who hasn't been in. That's the best way. I mean, we don't have to track it. That's the beautiful thing is it's all in Jane. The report section is so wonderful. And then I haven't looked at chat. I'm not sure what the customer support team said, but I love that little, what do you call it, Destin and Jane? It's like a little graph at the top right of Jane. That little graph
Mhm.
has so much gold under it. What do you call that button?
Oh, I can't even remember. Someone in the support chat can probably
Yeah,
help us out. What is that button called?
so it's not in the report section. So don't click on reports, but actually on the top right of your screen, there's a little like zip, zip, zip graph. And that
Is
button
it
has
the dashboard?
the dashboard. Thank you for the lingo. That has so much gold in it. So if you're not familiar with the dashboard, go in there and have a look at everything that's contained. There's so much in there. Jane tracks it all for you.
Amazing. And this is not really for you, Julie, but you might have a suggestion on this. But someone had asked in the chat, they were thinking about, you mentioned giving gifts to or thank yous to your admin staff. And someone was asking for, excuse me, other options or types of gift cards that they could give their admin staff. And so there was actually some really incredible suggestions in the chat. Someone suggested local bakeries or local coffee shops and things like that, or more like universal ones like a vanilla gift card. Someone said and there's a couple other services where you can do that. So yeah, I think that was just a really lovely. I don't know if you have any
I
specific
love it.
suggestions or things that you've seen before, Julie.
Well, this is so fun because we've talked to the Jane team about this before, specifically about what makes our teams really happy. And it depends where your team is located, right? Like if you can do a local bakery, that's awesome. I find that admin staff, we have found really great success with Indigo here in Canada, Indigo gift cards, Amazon. I don't know if you want to support Amazon, people have different opinions about that, but Amazon gift cards are a hit across the board. People love Amazon. So that's something to consider. Starbucks gift cards. Here in Canada, Aritzia is a big hit with women admin team members. It's a big hit with me. And so that might be something too. It sounds like you've got lots of options there.
Yeah, and anyone that's in the Jane community, that's also a great question you can ask in there, get some more feedback, especially if you're looking for something maybe more regional to your province or your state or something like that. So that's always a place to get asked the question. I think maybe we've got one more, which is maybe some suggestions on how to get recurring bookings into the calendar for next year.
Oh, that is a good one. Let me think on that for a minute. How to get recurring. I mean, this is part of the start, stop, keep. Like if you're really going to go in there and find out what your patients love and what they don't love about what you're doing in practice, why not send them a survey and make sure that you're doing everything? Maybe your hours aren't working for them. Maybe your front desk staff isn't working for them. There could be a number of different things that you could be doing better in practice. So I love the idea of setting open-ended questions in surveys. What should our practice start doing, stop doing? What isn't working for you? What should we keep doing? Why not ask them that to make sure that you're making your patients as happy as possible?
Oh, I love that. I love that approach, like chatting with your customers. I mean,
Yeah.
we try and do that as much as we can at Jane as well to figure out. We launched the poll that everyone just completed to get feedback on the session. We chat to you in the community and all sorts of things like that. So I love that finding out what's working and what's not working directly from your patients and your clients. That's amazing.
Jane does a great example of that. Yeah, we should all just copy Jane in our practices with how you treat your customers because we don't send enough surveys typically. Practitioners don't, and it is something that they can really consider doing more of in 2025.
Amazing. Well, again, thank you so much, everyone, for taking an hour out of your day. We really appreciate you taking the time. Have a great rest of your Tuesday and a great rest of your week. Thank you, Dr. Julie and the Ginger Desk team and the Jane team for being in the chat and Q&A. And thank you, everyone, for attending and for your great questions. So have a great rest of your day, great rest of your December, and we'll see you in some sessions in 2025. Thank you, everyone.